So hello everyone and welcome to my channel. In my today's video I am sharing yet one another amazing manual therapy skill for the patients who are having frozen shoulder or the bursitis or the painful shoulder syndrome. This is the 3-stage traction mobilization technique by which you can release the pain and inflammation on the shoulder joint and also increase all ranges of the shoulder joint. So let's start with the practical demonstration of the exercise. So for the practical demonstration, the patient is in the supine position and let's say the patient have the left side frozen shoulder. So what you have to do, you have to place your left hand in the posterior axillary fold and grab from your finger pads, and the right hand has to be placed on the anterior chest wall on the upper ribs and grab the anterior axillary fold, and your thumbs has to meet on the acromioclavicular joint for the stabilization purpose. So this is the starting position. Now you have to apply a self-led traction force to the shoulder joint, and at the same time the right hand has to be placed on the left hand to stabilize the glenohumeral joint. So you have to place your right hand and to grab the arm to stabilize. So right hand of the patient has to stabilize the arm, the left hand of the therapist has to be placed on the posterior axillary fold, right hand has to be placed on the anterior axillary fold, and the thumbs are meeting on the acromioclavicular joint. Now the therapist has to give a self-led traction force to the shoulder joint and hold this position for 30-60 seconds. This is the first way. Another way is to perform this traction in a rhythmic manner. Traction, hold, relax. Traction, hold, relax. Traction, hold, relax. You have to stay relaxed and relax. Again, the traction force is in the self-led direction. So this is the first step. The second step is you have to apply a traction force in a self-led and a lateral direction. Self-led and lateral. So this is the self-led and lateral direction. This and relax. Again this and relax. So this and relax. This and relax. So self-led and lateral, self-led traction and a lateral direction. So this force is in this direction, this self-led and lateral. So again I demonstrate self-led and lateral. So we have to pull the shoulder upward and in a lateral way and relax. And the third step is again you have to grab the anterior axillary fold, the posterior axillary fold, and meet at the acromioclavicular joint and give a traction. Now ask patient to external rotate, and then internal rotate. External rotate, internal rotate, external rotate, internal rotate, and relax. Again external rotate, internal rotate. Put your hand on the left hand for stabilization. Now perform external rotation, internal rotation, external rotation, and relax. So by performing this maneuver you can increase the ranges of all direction and also decrease the pain by the mobilization. So try this amazing manual therapy skill in the patients who are having frozen shoulder and let us know your valuable feedback in your comment section. Till then, stay connected and thank you.